My name is Austin Norton. My injury happened last November. It was the second game of my senior year. We were playing Pendleton County at their place, and it was the midway through the second quarter. I was on a fast break and I went up for a layup, and as I planted my left foot, I felt my knee pop, and I instantly went down to the ground in pain. The injury ended my senior year, and I had to sit there on the bench and watch the rest of the year, which wasn't fun. After my injury, I waited a few days. I continued to try to practice, hoping it would slowly get better. It didn't get better, it didn't get worse, so I figured I should probably go see Dr. Lane to get checked out.
Austin was seen in my office back several months ago after he had an injury to his knee during a basketball game. You know, he was having this vague pain and had some instability to his knee. You know, we ended up getting an MRI of his knee, and it showed us that he had a full thickness ACL tear, as well as a little lesion over his femoral condyle.
My mind was kind of just drew a blank. I was pretty lost because I've never had to deal with any injuries, and something that would set me back and not be able to do the things I enjoy to do all the time. So it kind of hurt a little bit.
So we talked about treatment options, and given his age and his activity level, we proceeded with ACL reconstruction soon after the injury. We saw him back a couple weeks after surgery. His skin was all healed. We get him into a specialized brace and get him into physical therapy at this point. Austin is somewhere around 8 to 9 months out from his injury, and he's back in the job force now, and he's doing pretty much everything he wants to do with his stable and functional knee.
Now that I've gotten better, I'm back to the outdoors, fishing, hunting. I'm an electrician, so I'm able to get in tight spaces like I need to be able to, or walk the highest points all the way up the steps, carry heavy things. I was very fortunate to have Dr. Lane near me versus having to go somewhere that's an hour away or an hour and 25 minutes away like Cincinnati or Lexington. He was close and available and got me in as soon as possible.
It's very important to know that, in the surrounding areas, me and Dr. Owens, we're here to take care of sports injuries, fractures, hip and knee, arthroplasty, shoulder arthroplasty, pretty much anything that you can get in Lexington or Cincinnati. We have the capabilities of doing right here in Maysville, and it saves our patients a lot of time and effort. My philosophy when I'm practicing medicine, given a patient, my recommendations is I just treat them how I would treat my father, my mother, my sister, my brother. Tell them what I think is the best thing to do, whether that be surgical, whether that be non-surgical, whatever I think I can do to make them get back to doing whatever it is they love to do.
Not only did Dr. Lane care for me when I visited him, but when I seen him out in public at like a basketball game or a volleyball game, he was still there for me and made sure everything was all right and continued to help me through the procedures. And that's what I love about Dr. Lane and Meadowview Orthopedic Care Center.